half hour out of your lives to learn a little bit more about health. And I have an agenda tonight in what I'm going to be talking about. And I'll tell you what my agenda is. I'll just be really upfront about it. It's to shift your thinking from a crisis-driven, pharmaceutical-driven way of thinking about health to a way of healing that actually helps give people hope, that have lost hope and that really can't do much anymore with their bodies. And so if you look at our culture, people are running around helter-skelter looking for, trying to get better here and there. And the pharmaceutical industry's actually convinced people that if they take more drugs, they're going to be healthier, when that actually is not the truth at all. So I want to switch you from that pharmaceutical way of thinking, and some of you here I know don't think like that so much, but my goal is to help you understand how the nervous system works and how it is crucial, absolutely crucial to healing the body, to getting the body to be healed. Now, I talk about a lot of things in my talks. You know, we talk about functional medicine, which is good. I talk about nutrition, toxicity, Alzheimer's, all of that. That's really important stuff. But this is like the main thing in my office. So we're going to talk tonight about how not to short circuit your brain, or how your body really works. So if you look at the nervous system, it's like a safety pin, okay? And you have the brain here, you have the body here, and you have loops of communication. And when that communication is broken, like letting a safety pin, unhooking a safety pin, that causes problems in the body. And the safety pin is a good analogy, because when the pin is actually hooked in there, it's, you know, you can't hurt yourself. And so all primary doctors who care for people with the intention to enhance and express their life, they understand this system. So if you look at how the nervous system works, and this is not a chiropractic philosophy, this is just basic science. Okay, you have loops of communication. So the brain actually sends messages out to the body. The body adapts to those messages and sends messages back to the brain. So something happens here, it sends the message to the brain tells the body how to adapt, and the body adapts. Sends a message back to the brain, and that's how it works, okay? So, just like if you hit your thumb with a hammer, your brain knows that pretty fast, okay? And it sends messages to the body to inflame it, to cause inflammation so you don't hurt it anymore. Well, these loops of communication this is just science. This is not something that's just privy to chiropractors, basic science. But anyone who doesn't know this and understand these pathways really is violating the laws of nature when making a diagnosis. I'm going to tell you how that works practically here in just a few minutes. So how important is nerve supply from the body to the brain, or brain to the body? So here's bad scenario number one. Okay, the French developed the guillotine. They beheaded lots of people. When the head is severed from the body, what happens? What happens? You're dead. Okay, so you cannot live for 1 second, not 1 second, without messages from the brain to the body. You cannot live. You can live. How long can you live, like, without oxygen? Then maybe 2-3 minutes. How about without food?
A lot longer.
Yeah, I mean, the average American male could probably live at least 60 days. The average obese American male could probably live from maybe 6 months to a year without eating. Okay? So, but you cannot live for 1 second without nerve supply from the brain to the body. And that's why that method of death works so well, okay? Let's look at bad scenario number 2, a partial severing of nerve supply to the brain to the body. And we saw that in Christopher Reeve, which very sad story. So much, but not all of the nerve supply is cut off. So it has a tremendous effect. The person still alive, there's a tremendous effect on their ability to function. So look at bad scenario number 3. Subluxations interfering with nerve supply from the brain to the body. So a minor subluxation or misalignment in the spine can cut off 60% of the nerve flow to an organ. And this is what chiropractors do. We correct subluxations. So the subluxation will destroy your spine eventually if it's not fixed. I see it all the time. People come in, especially as we get older, and you haven't cared for your spine. I see a lot of degenerative arthritis in the spine. A lot of that's correctable, preventable. I would say preventable if it's caught early on, okay? If you just let it go, it's like anything else. If you just let it go, it'll get worse over time. Think about your car. You know, if you don't change the oil, you know, eventually you're going to have some real problems, okay? Well, the body's like that. Now, let's look at the brain for a minute. The brain is constantly doing its best to keep our body alive and healthy. And even if we don't exercise, even if we feed it junk food, it's going to try and adapt and create and give you as healthy a life as it can. There's no evidence that a healthy brain can create sickness in the body. Now, is there evidence that a sick body can create an unhealthy brain? There's evidence for that. Oh, there's a lot of evidence for that. You got to come to my Alzheimer's talk. We'll talk about that. Oh yeah, because the brain, a lot of times when we're talking about brain-body relationship, tends to be downstream in terms of health from the body. So, but a healthy brain, you cannot create a sick body from a healthy brain. Now, if we look at the central nervous system, our bodies start with 2 cells which divide exponentially. The first thing that's formed in our nervous system, in our body, is the central nervous system. Brain, notochord, which becomes the spinal cord. Very first thing is formed. Okay? From there, all the organs develop off the nerves that are developed from the spinal cord. So you have the brain, spinal cord, nerves, and the organs are developed on the ends of those nerves. So really what's happening is the brain is directing the actual formation of the human being. Now, this happens pretty early on, like, you know, in the first trimester, which is why it's so dangerous to give women certain pharmaceuticals or expose them to toxicity in the first trimester, because it's a very delicate process and things can go haywire if you do. So the body tries to protect things appropriately. So vital organs are protected by the ribs. We have the skull, which is made of 22 bones, the spine, which is 24 movable segments, protecting the brain and spinal cord, or the central nervous system. Do you think it's a coincidence the brain and spinal cord are protected by bone? Is that just something that just sort of randomly happened through evolution? No, I don't think so. Okay, by weight, bone is 9 times stronger than steel. It's very flexible. Human living bone is very, very flexible. It's not hard like you see, like in a cadaver that's been there for a while. Very flexible. Subluxations have been described in several different ways. And, you know, I won't spend a lot of time on this. Dysfunctional movement of a joint irritating a nerve, that's probably the most common one you've heard. inflammatory process of the ligaments and discs and other tissues surrounding the nerves. So when that joint stops moving properly, it creates inflammation, which can affect the nerves. Outright compression of a disc, we've seen that. You can see that on MRIs. In fact, I had a patient recently who brought her MRI of her lower back into me. You could see the discs actually compressing the spinal cord. And here's one that's a little bit out there, but there's some truth to this. An electromagnetic charge from an inflammatory response creating changes in the tissue, which emit alteration in tone and electrical field. Now, do we have an electrical field surrounding our body?
Yeah.
Yeah, absolutely we do. Has anybody ever heard of people getting like cancer and sick from living under power lines?
Yeah.
Yeah, of course we have. So how does that work? It alters the electrical field around our body. When I do a muscle test and have you hold something, we're dealing with the electrical field of what you're holding and how it's interacting with your body. Okay, this is what a disc compressing on the spinal cord looks like right there. So if you look at the research that's been done on chiropractic, there's hundreds, literally hundreds and hundreds of articles out there that have been published that show how chiropractic works. So one of the researchers, a woman by the name of Heidi Havoc, and what she found is that chiropractic adjustments change processing in the prefrontal cortex right here, this part of your brain. And that part of your brain affects mental health, immune system, inflammation, the endocrine system, GI system, sleep, blood pressure, pain, heart rate, and attention and focus. Chiropractic adjustments affect that. We have solid research that shows that. There's another thing that Heidi Havoc found, is that when we adjust somebody, it changes their proprioception, their hand-eye coordination, foot-eye coordination, and it processes proprioception info from the upper limbs down to the lower limbs. So again, and these are all the articles that she's published that show that. So that, I mean, that's something, and you know, professional athletes get adjusted, a lot of them, and this is one of the reasons why. Another reason is to get them out of pain, to get their bodies working right, but their proprioception is better. And let me tell you something, at the Olympics, a couple of Olympics ago, the head doctor over all the other doctors was a chiropractor. You know, and you say, well, how does that work? Well, because Olympic athletes demand chiropractic because they don't want to take drugs. They want to do things that help their body function better. In fact, that guy who was head doctor over the Olympics came and spoke to our state association several years ago. So the prefrontal cortex is like the brain's conductor, and chiropractic affects that. So the scientific evidence proves that when people get adjusted with subluxations, their body just works better. It enhances function. So there's 3 ways to look at chiropractic. I don't believe in chiropractic. Anybody ever heard that before? Yeah, I've heard it. Chiropractic is only good for pain relief. Okay, anybody heard that? Okay, yeah, a lot of people feel that way. Here's a 3rd way to look at chiropractic. It enhances the way my body works, and thus the expression of life and organ function. Now, let me tell you an interesting story. I just heard this today from a patient. I don't know, she may be watching this tonight. A patient I really like. I like all my patients, actually, she told me that, you know, I've been seeing her now. This is her second 12 visit segment, and she said, you know, not only does she look like 5 years younger than she did before she came in, but she told me today, she said, I'm getting all my energy. My energy is starting to come back. Now, she felt better from a pain standpoint before that happened. But it takes time for your body to change. Now, she's in her, I can't remember how old she is, but she's younger than we are, let's put it that way. So she says, I feel so much better and my energy is starting to come back again. And so, if you only use chiropractic for pain relief, you're not going to get this benefit, because this benefit usually comes after this. So chiropractic is not necessarily designed to make you instantaneously feel better. Chiropractic is designed to make you instantaneously heal better. So I get adjusted every week. Once a week, I get adjusted on Sundays. I go up to my chiropractor. We adjust each other every Sunday. And I don't always feel different when I leave. Sometimes I feel the same. Why do I get adjusted then? Because I'm not in pain. I don't have any chronic pain. Why do I get adjusted? Why would I do that? Anybody?
Maintenance.
Yeah. I want to maintain my health. I don't want to develop chronic pain. And so a lot of people, and I have a certain segment of people, that when I get them out of pain, they stop. I don't see them again until they have a real crisis. Then they're back in my office, limping back in a lot of pain. And I try and tell them, look, if you let me maintain you, your chances of this happening go way down. I'm not saying it could never happen again. It just goes way down, okay? So when you get adjusted, you may not feel a lot different, but it's designed to instantaneously help you heal a lot faster, a lot better. So if you study the loop between the brain and the body, do the messages need to travel at 100%, would you say? They should, okay? Does the liver that's trying to detoxify all the toxicity that we're exposed to, does it need 100% nerve energy to do that right? Yeah, I would say it does. And let me say, I see a lot of dysfunctional livers in my practice, a lot, okay? Does a heart require 100% nerve flow without interference from subluxation to work properly? Yeah, heart's tied into the nervous system like everything else. Sean, stand up for a minute. Let me show you something. Okay. Just want to show you something on him. So the nerves of the heart are right up here, right in there. The nerves to the liver are here. Mm-hmm. So what's interesting is I see these two areas. I find them all the time in people. Areas here and areas here. People are toxic and they're stressed, and it shows up in their spine. Thanks. And so think about this. In a couple of weeks, I'm going to be talking at a company that's basically electricians, and I'm really looking forward to it because the spine is like a fuse box. And when you have an overloaded circuit breaker, it trips. When a place in your spine is overloaded, it doesn't shut off, but it turns way down. And so that's when you get problems in organs. Okay? Now, Keith Wassum has developed a lot of great videos on chiropractic. He's not a chiropractor, but he said, thinking of chiropractic only as pain relief is like robbing a bank and stealing only the pens. And they won't even let you do that anymore. They got them chained down, They don't want you taking their pens, okay? So let's look at some of the ways that our culture deals with pain, back pain. So cortisone, okay? Has anybody in here ever heard of somebody getting a cortisone shot in their back? Yeah. I'm not saying you should never do that. But what cortisone does is it gives you a false sense of security in your spine. In other words, this is not health care. This is crisis care when things have gotten so bad that you have to have a cortisone shot. Let me show you a study. This was in the 2019 journal called Radiology. And here's what it said about cortisone and steroid injections. Number one is they have a tendency to accelerate osteoarthritis. I don't know about you, but I don't want that, okay? They can cause subchondral insufficiency fractures. So that would be a fracture right below here, right in this area here. It can cause the bone to just start dying. And it also can cause rapid joint destruction with bone loss. So there's some significant downsides to getting cortisone shots. And again, I'm not saying nobody should ever have them. I'm not going to say that. But you just need to know that what the literature, scientific literature says about getting cortisone shots. So chiropractic can be a little slower, but it's much more in tune with your body's need to feel safe. And if your body's giving you pain, is there a reason for the pain? Yeah. Is it a good thing that we can feel pain? Yeah, it's a really good thing. So if we just cover up the pain, it's like, if our oil light goes on in our car, taking a screwdriver and just, punching out the light and saying, okay, everything's okay now. Well, that's a symptom that there's something really bad going to happen with your car if you don't do something in a hurry. Well, pain can be the same way in your body. So we've shown that the minor subluxation, pressing on your nerve with the weight of a dime, can cut off 60% of the nerve flow. Only 10% of your nerves deal with pain. Only 10%. Anybody know that? 10%. Okay, so what do the rest of the nerves do?
Communication.
Okay, to where?
The brain.
Okay, so if only 10% of your nerves feel pain, the other 90% have to do something. So how about things like this? How about running all your organs, like your digestive system, your heart, your liver, your lungs, all of that? That's what the other 90% does. So what does that mean for your health? What does this mean? If 10% of your nerves deal with pain, the other 90% deal with function, what does that mean for your health? Anybody?
It'll take care of your 90%.
Okay. What it says to me is that just because you don't have pain doesn't mean you don't have massive loss of function. Because what if part of your nervous system that doesn't deal with pain is being compressed? You don't feel it. You don't even know what's happening. Okay? This is why it's important to get care, maintenance care, even if you don't feel pain. Because only 10% of your nerves sense pain. The other 90% deal with the other functions of the body. So if your liver is only functioning at 40%, you may not realize something's wrong. Okay? Your liver doesn't feel pain. Your organs generally don't feel pain. I mean, your GI, your colon does if it's stretched. But you can cut through someone's colon, and they don't even feel it. It's only if it's stretched. Okay, so we don't always know if something is wrong. Okay, just because because we don't always feel pain, because only 10% of our nervous system is involved in that. So if you look at children, so kids, they may not experience pain, or they may not know how to express it. But when they're subluxated, they get chronic colds, allergies, food intolerance, behavioral issues, ear infections, sore throats, all of which stem from interference between the brain and the body. Now, can these things be from other issues? Yeah. If you feed kids junk food, if you feed them, the standard American diet, and highly processed foods, you know, they're gonna have all of these. But they'll get this as well from subluxations. And kids tend to get way better when you adjust them. So this is an article in a prominent neurobiology journal in 2014 that showed that subluxation in the upper part of the neck, which is very common, can cause problems all over the body. Heart issues, respiratory issues, the entire autonomic nervous system can be affected. We've known that for years just from experience, but this is a journal that's actually saying it. So this is one reason it's difficult to understand how chiropractic can work, because people tend to think of chiropractic as back pain. They don't see it as a system of health for the entire body. So, and people say to me, you know, do you have to go back for the rest of your life? You know, do you have to? Well, you don't have to. I mean, you know, you don't have to get adjusted, but doesn't it make sense, since our nervous system controls everything? Our nervous system is housed in the spine. It's intimately connected with the spine. And if you leave it go and you don't do anything about it, you're going to have subluxations and degeneration and problems. Doesn't it make sense to take care of that? It's like brushing your teeth, you know? Do we only brush our teeth when they hurt? No. In fact, hopefully our teeth rarely hurt, okay? No, we do it because it's the right thing to do, because I want my teeth when I die. I want all my joints when I die. I don't want a knee replacement or a hip replacement. I certainly don't want dentures if I can help it. So that's why we do it. Even Tour de France riders get adjusted, whether they need it, whether they hurt or not, and racehorses get adjusted. You know, a lot of the animals that I see animals on Saturday. I adjust animals. I don't have any horses in here, but I have some dogs and cats. And what the owners tell me is, wow, you like, the energy to my dog got turned on. I can hardly keep up with him now. Okay? They didn't know that, they didn't come in because the dog said, well, I have a migraine. Would you take me to the chiropractor? Their dog just isn't working right, that their body's not working right. And a lot of times, they just need to be adjusted. So, I'm just going to ask you tonight, who do you know, who can you think of that might need to at least get checked to see if chiropractic could help them? Who do you know that might have a problem that might be able to be helped through chiropractic care? At least get checked. I mean, you know, if it's not a chiropractic case, I'll send them somewhere else. But if it is, maybe we can change their life. Maybe we can get them to the point where their bodies are working better, where they can work again, they can play sports again, they can walk again. And we want to try and get people, before their spines are so degenerated that you know, it just takes a long time to get them back to normal. So I just want you to think of somebody, and you know, just talk to that person. Now this talk's going to be posted on our Facebook page, so you could refer that that individual to our page and have them watch this, or just have them call and come in, make a 10-minute appointment. We'll screen them at our expense. If we can help them, great. If we can't, then we'll let them know that too. Okay? Anybody have any questions over anything I've talked about tonight? Okay, clear as mud? Okay.
Yeah.
Good. Okay, great. Well, thanks for being here tonight, and God bless you. And the next talk we're going to do is on emotions and health, and that will be December 10th.